Hello everyone, this is a very simple and a short video for the competitive exams like your TNMRB 2026 and your NEET PG 2026 and INISET. So these are the main important points you cannot miss out. So I have taken triads in pediatrics, so the most important triads I have taken in pediatrics. Okay, yes, first one is your congenital toxoplasmosis. So in congenital toxoplasmosis, the triad constitutes one is your hydrocephalus. It constitutes hydrocephalus, chorioretinitis, and your intracranial calcification. This intracranial calcification is a diffuse cerebral calcification. Okay. So it is a diffuse cerebral calcification. You can see the image here. The child will have hydrocephalus and these are their calcification. It is a diffuse cerebral calcification. So the triad of your congenital toxoplasmosis constitutes chorioretinitis, hydrocephalus and intracranial calcification. Next, congenital CMV infection. In congenital CMV infection, your triad consists of, first one is your chorioretinitis, second one is microcephaly. In toxoplasmosis it was hydrocephalus, here it is microcephaly. Okay, and next one is the pathognomic feature of your CMV infection is periventricular calcification. So periventricular calcification is the most pathognomic feature, right? Yes, periventricular calcification. Here you can see these are their periventricular calcification. This one, fine. Yes. Next is your congenital rubella syndrome. This question was asked in your TNMRB 2024, right? Yeah, very easy question. So your congenital rubella syndrome constitute sensorineural hearing loss. Next is your cataract. The other one will be your congenital heart disease. Among your congenital heart disease, PDA will be the most common one. So congenital rubella syndrome constitute sensorineural hearing loss, cataract and your PDA. Fine. Next question or a next triad is your congenital syphilis. It's also called as Hutchinson's triad. In this Hutchinson's triad, you have first one, you can remember this by your this monkey pose, that Gandhiji's monkey. So do not see, do not hear, do not see the bad things, do not hear bad things and do not talk bad things. And the madri, you can remember it by that monkey way. Why? Because it involves the teeth. In teeth you have your what is called as Hutchinson's teeth. This Hutchinson's teeth is nothing but a peg-shaped teeth. It is nothing but your peg-shaped central incisors. It is nothing but your peg-shaped central incisors. Next one is your sensorineural hearing loss. In ears you have sensorineural hearing loss. In eyes you will be having your interstitial keratitis. It is interstitial keratitis. So first one is your sensorineural hearing loss, next one is your interstitial keratitis, and the third one will be your Hutchinson's teeth. It is your Hutchinson's teeth. It is a peg-shaped central incisors. Okay, these are the triad that is constituting your Hutchinson's triad of your congenital syphilis, right? Yes. Next is your Prune belly syndrome. In Prune belly syndrome, you will be having, or the child will have this one. You can see there will be a abdominal wall defect. That is, there won't be muscle in the abdominal wall. So that is constitutes your abdominal wall defect. Secondly, there will be a genitourinary defect. Here you can see there will be a genitourinary defect in the child. And third one will be cryptorchidism. So these are the three things that is constituting your Prune belly syndrome. The sixth one is your Alport syndrome. In Alport syndrome, so Why? Because we are talking about triads in pediatric, meaning they can ask the question like this: all of the things can constitute the specific syndrome or specific disease, except they can be questioned like that. So that only we are discussing triads in pediatrics. Okay. In Alport syndrome, there will be your sensory neural hearing loss. Next one will be in eyes. The child will have anterior lenticonus. And next one will be your hematuria. So Alport syndrome constitute your eyes, ears, and in your kidney, that is your hematuria. So it is sensory neural hearing loss, anterior lenticonus, and hematuria. The next triad will be your West syndrome. In West syndrome, the child can have developmental delay. Next one will be your clinical spasm. West syndrome I have explained in detail in our another YouTube channel, that is Dr. Vidhu's pediatric classes. Please go through that for the complete detail about your West syndrome. So the child will have developmental delay, clinical spasm, and the EEG will show hypsarrhythmia. These are the three things that is constituting your triad in West syndrome. Thank you for your patient listening. Let's all learn pediatric together, and let's learn important points and make pediatrics simple. Thank you. Please like, share, and subscribe our YouTube channel. So I'll share this PDF in our WhatsApp group, that is Pediatrics University Exam, PEDS University Exam discussion group. Please follow that link or WhatsApp group for more updates in pediatrics. Thank you so much.